Which is the primary goal of proper body mechanics in nursing? Options are A. To enhance nurse flexibility, B. To improve physical appearance, C. To prevent injury to the nurse and patient, D. To develop muscle strength. Now let's see what is body mechanics, which is coordinated effort of the muscle and skeletal and nervous system to maintain one's balance, posture and body alignment during whenever you lift something, move, positioning and performing activities of daily living. So this is called as body mechanics. It has to be used when you lift something and whenever you do something, widen your base for support. You always have to bend your knees while you want to take something from the floor and tightening your stomach muscle and keep your load very close and keep your back straight. These are some of the techniques that you use in body mechanics. Back to the question. So, what is the answer? Yes, the answer is C, to prevent injury to the nurse and patient. Proper body mechanics reduce the risk of musculoskeletal injuries for both the nurse and patient during patient care activities. What is the best site for assessing the pulse in a patient in cardiac arrest? Options are A. Radial artery, B. Brachial artery, C. Femoral artery, D. Carotid artery. The answer is D. Carotid artery. During cardiac arrest, the carotid artery is the most reliable site for pulse assessment due to its proximity to the heart and easy of access. Which is a key principle of sterile technique? Options are A. Keep hands below the waist level, B. Use only clean gloves during procedures, C. Avoid reaching across a sterile field, D. Sterile items can be placed on any surface. The answer is C. Avoid reaching across a sterile field. Reaching across a sterile field can contaminate it, violating sterile technique. Hands must be remain above the waist, not below the waist, and sterile items should be handled appropriately. What is the primary purpose of the nursing process? Options are A. To develop nursing knowledge, B. To promote patient centered care, C. To evaluate healthcare systems, D. To document nursing actions. Answer is B. To promote patient centered care. The nursing process is a systematic, patient centered approach to provide individualized care by assessing, diagnosing, planning, implementing, and evaluating nursing interventions. Which stage of pressure ulcer involves full thickness tissue loss with exposed bone, tendon, or muscle? Options are A. Stage 1, B. Stage 2, C. Stage 3, and D. Stage 4. Answer is Stage 4. Stage 4 pressure ulcers involve full thickness tissue loss with exposed bone, tendon, or muscle. This stage also includes the possibility of slough or eschar. What is the normal range for adult respiratory rate? Options are A. 8 to 16 breaths per minute, B. 12 to 20 breaths per minute, C. 16 to 24 breaths per minute, D. 20 to 28 breaths per minute. The answer is B. 12 to 20 breaths per minute. The normal respiratory rate for a healthy adult at rest is 12 to 20 breaths per minute. Deviations may indicate underlying health issues. What is the correct angle for administering a subcutaneous injection? Options are A. 15 degrees, B. 45 degrees, C. 60 degrees, D. 90 degrees. The answer is B. 45 degrees. Subcutaneous injections are typically administered at a 45-degree angle to ensure the medication is deposited into the fatty tissue beneath the skin. Which is the most effective way to prevent the spread of infection in healthcare settings? Options are A. Using gloves for all procedures, B. Performing hand hygiene, C. Disinfecting patient equipment, D. Isolating all patients. The answer is B. Performing hand hygiene. Hand hygiene is the single most effective measure to prevent the transmission of infections in healthcare settings. Proper hand washing or using alcohol based sanitizers significantly reduces the spread of pathogens. Which nursing intervention is the highest priority for a patient at risk of aspiration? Options are A. Encourage deep breathing exercises, B. Place a patient in a semi Fowler's position, C. Monitor oxygen saturation levels, D. Provide oral care after meals. Answer is B. Place the patient in a semi-Fowler's position. Placing the patient in a semi-Fowler's position reduces the risk of aspiration by preventing gastric contents from entering the airway, especially during and after feeding. Which of the following reflects a sterile technique? Options are A. Wearing gloves for dressing a wound. B. Maintaining sterile fields while inserting a catheter. C. Washing hands before touching a patient. D. Cleaning instruments with disinfectant. Answer is B. Maintaining sterile fields while inserting a catheter. Sterile technique involves procedures that eliminate all microorganisms to prevent infection, such as maintaining sterile fields during invasive procedures. What is the most accurate method to assess a patient's body temperature? Options are A. Axillary temperature, B. Oral temperature, C. Rectal temperature, D. Tympanic temperature. The answer is C. Rectal temperature. The rectal route is the most accurate method to measure core body temperature because it reflects the internal temperature of the body more accurately compared to oral, axillary, or tympanic method. Which electrolyte imbalance is most commonly associated with diarrhea? Options are A. Hyperkalemia, B. Hypokalemia, C. Hypernatremia, D. Hypocalcemia. Answer is B. Hypokalemia. Diarrhea leads to excessive loss of potassium, resulting in hypokalemia. A sudden severe drop in serum potassium may cause heart problems. A more and gradual drop in potassium may cause muscle cramps in arms or legs. When performing a bed bath for a patient, what should the nurse wash first? Options are A. Arms, B. Chest, C. Face, D. Feet. Answer is C. Face. The face is washed first during a bed bath to ensure cleanliness in a sensitive area and prevent contamination from other body parts. What is the proper angle for administering an intramuscular injection? Options are A. 15 degrees, B. 30 degrees, C. 45 degrees, D. 90 degrees. Answer is D. 90 degrees. Intramuscular injections are administered at a 90-degree angle to ensure that the medication reaches the muscle tissue. What is the recommended site for an intramuscular injection in infants under 12 months of age? Options are A. Deltoid muscle, B. Dorsogluteal muscle, C. Vastus lateralis muscle, D. Ventrogluteal muscle. The answer is C. Vastus lateralis muscle. The vastus lateralis muscle is the preferred site for IM injections in infants as it is well developed and avoid major blood vessels and nerves. What is the best way to assess for correct placement of a nasogastric tube? Options are A. Auscultating air over the epigastric region, B. Testing the pH of aspirated stomach contents, C. Observing the patient's ability to swallow, D. Asking the patient if they feel the tube. Answer is B. Testing the pH of aspirated stomach contents. Checking the pH of gastric aspirate is the most reliable bedside method for confirming NG tube placement as gastric fluid is acidic. Which oxygen delivery device provides the highest concentration of oxygen? Options are A. Nasal cannula, B. Simple face mask, C. Non-rebreather mask, D. Venturi mask. Answer is C. Non-rebreather mask. A non-rebreather mask delivers the highest concentration of oxygen up to 95 to 100% by preventing exhaled air from mixing with inhaled oxygen. What is the normal range of serum potassium in adults? Options are A. 2.5 to 3 milliequivalent per liter, B. 3.5 to 5 milliequivalent per liter, C. 5 to 6.5 milliequivalent per liter, D. 6.5 to 7.5 milliequivalent per liter. Answer is B. 3.5 to 5 milliequivalent per liter. The normal range for serum potassium is 3.4 to 5 milliequivalent per liter. Abnormal levels can cause cardiac and muscular complications. What is the appropriate nursing action when administering medication via a nasogastric tube? Options are A. Mix all medications together before administration. B. Flush the tube with 15 to 30 ml of water before and after each medication. C. Administer all medications without interruption. D. Use cold water to dilute medications. The answer is B. Flush the tube with 15 to 30 ml of water before and after each medication. Flushing the tube prevents clogging and ensure that the medication is delivered effectively. Medication should be given one at a time with flushing in between. Which statement best describes informed consent? Options are A. It is obtained by the nurse before any procedure. B. It is the patient's agreement to a procedure after understanding its risk, benefits, and alternatives. C. It is only required for surgical procedures. D. It can be given verbally or through gestures. Answer is B. The informed consent is the patient's agreement to a procedure after understanding its risk, its benefit, and other alternatives. What is the recommended duration for hand washing with soap and water? Options are A. 10 seconds, B. 15 seconds, C. 20 seconds, D. 30 seconds. Answer is C. 20 seconds. Hand washing for at least 20 seconds effectively removes most germs and contaminants. Which intervention is appropriate when a patient complains of shortness of breath? Options are A. Place the patient in a supine position. B. Administer oxygen without a physician's order. C. Elevate the head of the bed. D. Restrict fluids. Answer is C. Elevate the head of the bed. Elevating the head of the bed helps to improve lung expansion and breathing by reducing pressure on the diaphragm. A nurse is administering digoxin to a patient. What should the nurse check before administration? Options are A. Respiratory rate, B. Blood pressure, C. Apical pulse, D. Blood glucose level. Answer is C. Apical pulse. Before administering digoxin, which is a cardiac glycoside, the nurse should check the apical pulse. If it is below 60 beats per minute, the medication should be withheld. You are not supposed to give the digoxin. Why? The digoxin can cause bradycardia. Again, the patient has a prescription for medication to be administered TID. How many times should the nurse administer the medication? A. Once daily. B. Twice daily. C. 3 times daily. D. 4 times daily. Answer is 3 times daily. The TID, Terindai, means the medication should be administered 3 times daily. When preparing a liquid medication for a patient, where should the nurse read the measurement? Options are A. The top of the meniscus. B. The bottom of the meniscus. C. The side of the cup. D. Anywhere along the meniscus. Answer is B. The bottom of the meniscus. Liquid medications should be measured at the bottom of the meniscus. Meniscus is the curve you can see at the liquid surface to ensure the accuracy. If you find the video useful, please like, share, subscribe the channel Nursing Exam Insight, the ultimate resource for all nursing exams. Thank you for watching.